Hello, welcome back to another video. In this video, I think we're discussing something quite important, and I would say is a how do I even say it? It is a hot topic because many people come across it, and it is a very frustrating problem. And because sometimes it feels like doctors are our gatekeepers that stop us from achieving what we want. It's very difficult to communicate to another individual as it is, let alone someone that can decide what is happening to you, and that could be a person that could be restraining you from finding relief. So it's definitely a big topic, and we'll be discussing. So the topic is how to be taken seriously by your doctor. The 10 tips that I have for you. These are not original from me. I had to do a bit of research, and I'll just go through the 10 tips, and add a bit of my input to it. So I hope you like this video and you find it useful. All right, so the first tip, which I think is the most important tip and I think is the most effective tip, is focus on the effect of pain on your functionality. So focus on the effects of pain on your functionality instead of rather just saying I'm in pain or how much pain you're in. So example is like, you don't go to the doctor and say, oh, my pain is super bad today. Super bad doesn't really mean too much to your doctor because they can't feel the pain. But if you describe it in functional wise, like, oh, you can't get out of your bed, you can't go to the shower, you can't go to work, then that's a lot easier for other people to comprehend. Like, we've all been sick in bed and you can't go to work, right? Or you can't go pick up your kids and whatnot. So it's a lot easier for people to understand, to comprehend. So describe the of effects on your functionality. Now this is really written really well, so I'm not gonna use it in my own words. No self-reported measures of intensity, so no matter how you describe it, will be as effective as the functional effects. So pretty much what I just described in the past. So describe what you can't do. Another reason why it's really good to actually just focus on the effect on your functionality is that even if your goal, so our goal is to be in less pain, expressing in terms of the functionality is less likely for the doctor to kind of label you and stereotype you, right? Instead of like, this is a pain patient, they'll be thinking like, this is a person that needs help. How do I make them go to work? How do I make them, be able to do their gardening and so forth? So switching from, oh, this is a pain patient into a person with an issue that I need to fix. So I think this is a really good one, really true one. The other thing, which is also really great, really good point, is that it gives a starting point. Sorry, it also gives a starting point for future dose escalations. Why? Without becoming like, oh, she wants to, wants more of the drug, or he wants more of the drug. You're referencing your progression, right? You're just going like, okay, I wish that I can I can walk around the block, right? Okay, I really want to be able to pick up my kids, right? So starting a reference point of right now, today, that I can't do this, and then we'll try X and X therapies, and if it doesn't work, 2 weeks later, 2 months later, you come back, and they can see that you really want to get to that stage, that you'll be able to pick up your kids or walk around the block, which will be really good for your body. And so instead of, then that way the doctor's not going to think that, oh, so-and-so just want more drugs because of the pain relief. No, so-and-so wants the drug so they can be active in life and be a participant in participating in the world. So this is a really good one. All right, so the second tip is discuss secondary effects. So I think this overlaps with the previous one quite a bit, but it doesn't hurt to add a bit more. So what are these secondary effects? For example, talk about the impact of pain on your sleep. Talk about the impact of pain on your sex life and impact of pain on your social life, right? So everyone knows what insomnia feels like, right? And everyone knows everyone knows how terrible it feels. Um, so it's a lot easier for your doctor and other people to relate to. Talking about sex life, sex life is an important part of relationships, right? So I think, everyone has sex urges, so it's a lot, again, easier for other people to relate to. Socializing, everyone, we're social animals, so people can relate to not being able to see their friends, not being able to see their family. I mean, with COVID especially, you might be aware, I'm pretty sure everyone, right? You might not be able to travel interstate or go to another cities to see your grandpa, grandma, and especially with COVID, if someone passed away, you can't even go to their funeral. So a lot of people can relate to that. So it's a lot more relatable than just saying, I have a lot of pain, please help me with pain. So the second tip is to discuss the secondary effects. The third tip, and I definitely think this third tip is really, really good because it was really effective for me. So the third tip is to bring another person with you to ask questions. And I think it's more like just bring someone with you, someone with a sound mind, someone that you think that you trust. So why would bringing someone with you be helpful? So I see quite a few advantages. The first one is that you're kind of diverting the question from, instead of just imagine you're the doctor and then I'm asking you questions. And then you have another person here asking you your questions. So instead of the patient always asking the questions, like if you keep hearing the same questions coming from the same person, it kind of gets annoying, But if you have another person with you, maybe someone that is a lot more grounded, then it kind of diverts all these questioning from just one person, and I think it feels a lot less stressful. I don't know, I'm not a doctor, but I would imagine it's less stressful because it's coming from two people. So instead of the doctor feeling antagonized by the patient, you're kind of spreading the load with another person. And I also feel like being concerned about getting better, instead of just me being concerned that I want to get it better, there'll be another person there that also is concerned about this subject matter and want me or the patient to get better. So you can imagine if a little kid goes to the pediatric. And the mom and the dad both are really concerned about the kid, and the doctor kind of feel a bit stressed, maybe a bit of peer pressure to put in more work. But I actually don't see it as a peer pressure. It's more like, there's imagine a group of people caring about a subject, a goal. There's more power behind it instead of just one person wanting to get better. It'll be two, three in the whole group of people wanting things to get better. So I think, that's another reason to bring someone with you. And this is from my own experience. It's because the patient or us is in a lot of pressure, under a lot of stress because of the pain, worrying every moment of the day. It's helpful to bring someone with a sound mind, that's clear mind, that can listen to what the doctors are saying, and then help us analyze. Because when studies have shown that if you're stressed and if you're worried, you make terrible decisions, right? So it actually hinders our decision making. So bringing someone with you, they can help you analyze after the appointment. They can also help you remember things that you might have forgotten or you didn't hear properly. So that's another reason why I think bringing someone with you is going to be really good. Yeah, so that's the third tip. All right, let's move on to the fourth tip. The fourth tip is to research specific diagnostic tests in advance. So do a bit of Google research, do a bit of internet research. If you know if you kind of know what is happening, so if it's back pain, you might just do some Google and research into what's the difference between CT scans, how that differs to MRI or X-rays, right? So kind of be familiar with them, and maybe you can look into it and see what the differences are. Or you can say research into different blood markers, right, for blood tests. So you might research, try to familiarize yourself with like inflammation markers or rheumatoid arthritis markers. So kind of do a bit of research ahead of time before your meetings. Because for example, if you go to the doctor and at the end of the session, he says that I'm going to do, say, a X-ray on your back. You might have the opportunity to ask them, hey doctor, what's the difference between a CT scan and an MRI scan? Or what do you think about doing an MRI scan? So then that gives you the opportunity to, I guess, ask more questions and be more informed, because they're gonna respond better with more information. And the other thing is that I think it also shows that you have initiative and that you care about getting better. Because I think like if you want to get better, the doctor can feel that, and he or she is gonna take you more seriously. If you're all quiet and you really don't you just you know what I mean, and they're probably just not gonna get enthusiastic about trying to get you to a better place either. So showing initiative, working well together, trying to solve this problem together with your doctor makes it feels more like a teamwork rather than like a patient that doesn't really want to get better. So so research your specific diagnostics in advance. The fifth tip, I don't really quite get this one, so maybe you can comment below. It says to position everything as a question rather than assumption. It pisses doctors off. So I guess I don't really get this one. So probably just leave a comment. Position everything as a question rather than assumption. Or maybe I'm too dumb to get it. I assume. I don't know. I'm not sure about this one. So anyway, we'll leave it. All right, let's move into the next one. This one's not really for me, I must say, because I'm a pharmacist. I'm really into scientific Western medicine. So it's not the tip for me, but I can see how it makes sense. It says, ask your questions directly and don't say that you heard it from like an alternative medicine source. So don't say you heard it from your naturopath, or you don't say that you heard it from a herbalist or tradition. Anyway, you know what I mean. So I think it's I need to explain it too much, because you are talking with someone that specializes in Western medicine. They are bound to have bias towards naturopath, alternative medicine as hocus pocus. So it makes a lot of sense. So instead of saying that, rather than saying that your brother's wife's cousin's colleague's daughter said that who's a naturopath said that seaweed is going to be really good for my condition. What do you think? Don't say that. Just say that, hey, what do you think? Do you think seaweed's going to help? I heard it's going to help. What do you think? So I guess you're avoiding the triggering words that doctors might have. So yeah, just straight out and ask them. The next tip is pretty much the same thing. So straight out ask your questions that you may have heard or read online on the internet. As we all know, doctors hate Dr. Google. It's just, it's not, yeah, they just don't want to be competing with Dr. Google. So it's just better to ask you questions straight out rather than just saying that I heard from the internet, I heard from so-and-so YouTuber that said something. Just straight out and say that, hey, what do you think about this and that? So I think this one's quite self-explanatory. All right, we're coming to tip 7. Tip 8, 9, 10. So the last 3 tips. These are all quite self-explanatory, quite easy to understand. You just need to be aware of it. The next tip, try not to get overly emotional during your appointment. Not only is it stressful for the doctor, and it also puts them in a bad and resistant mood. So as I said, it's quite self-explanatory. The challenging part is that chronic pain is an emotional experience. It is very, very emotional. So it's very hard not to be emotional. But you could also see why being emotional is not the best course of action during your appointment. So if you are someone that is emotional, then just be aware that you are. And I think that awareness will help you during the appointment. Because when you see yourself emotional, you can go like, oh, give me a second. I want to pull myself together. The other thing that I can think of is that if you can bring someone, as I mentioned in the other tip, if you can bring someone with you, because when you start to get emotional, you can, like you're aware of it, and then you're trying to pull yourself together. There's kind of like that dead, eerie silence. Like the other person can continue the conversation while you try and pull yourself together. So bring someone, or just be aware of it. I think also it doesn't hurt. Now this might be controversial. It doesn't hurt to apologize at the end, but I think it's like, don't see it as an apology. Even though you're saying it in a way of apologizing, it's more like knowledge, right? It's just showing them respect, because when you're emotional, it puts other people in a bit of an awkward situation, even though it's your doctor's job to be, empathetic and know how to, but it's just apologize if you can, I would say. If you're not comfortable, then by all means don't. But this is something I think. The next one is also quite self-explanatory. Avoid exaggeration or catastrophizing. Because if you exaggerate and you catastrophize, then it's likely to backfire. Right? It kind of feels like lying. Like, I know that in the experience you feel like this is real, that it is really that bad, and it is really that bad most of the time. But like, I don't know. I think it's quite self-explanatory. It's just it's not good. It just doesn't help. Even though you mean it, even though it's true, it just doesn't help in this situation. So, try not to exaggerate and try not to catastrophize. And it's just this is probably one of the harder tip that I don't like to give, because like I know, like in the beginning of my experience, it is really, you really feel every thought is real. Like it is really that bad, and sometimes it is. Most of the time, it is really that bad. So I guess if you turn this tip around to be like, don't focus on these extremities, focus on functionality, and focus on getting better. I think that's probably a better way of saying this tip. All right, the last one. Do not threaten your doctor or give them an ultimatum. So this is obvious. But I still have, like we should still say it, right? Just be aware that if you're doing this, stop doing it. Because again, you have to try and work together with the doctor. And by threatening, no one likes to be threatened. Absolutely no one likes to be threatened. So don't threaten them. And also don't say that if you like, so example of a threat would be like, if you don't give this medication, I'm gonna call the medical board on you and so forth. So don't do anything. There's also another tip that I didn't really include. It's like, don't demand which medication that you want to use. It's just like, I think over time you get better at working. I was pretty young. Like I was 28 when I started chronic pain, right? And at first I didn't know how to work with the doctors, but like it's been like 12, 13 years now. So you get better at talking to the doctor. So it just all comes down to experience. So if you made any of these mistakes, it's a-okay. You gradually get better at working with the doctor, but you gotta at least have the mindset like, how do I want to get better at working with the doctor, and then you think of ways to work better with the doctors. So anyway, that's the end of the video. I hope of course, I truly hope that you find these tips helpful, and I wish you all the best, and I'll see you in the next one. If there's the next one, we'll see. I don't know.